Hi, everyone, and welcome back to MS Neuro TV, brought to you by MS Views and News and sponsored by Sanofi-Genzyme, Biogen, and Celgene. We're so happy to see so many of you back with us here today. My name is Ana Fernandez de Castro, and I am the Assistant Development Coordinator at MS Views and News, and I'm here today with Jennifer Falk, our Director of Development. So, MS Views and News is a nonprofit organization dedicated to providing education and information to the multiple sclerosis community. And today, we're really happy to welcome back Dr. Megan Weigel as she explains to us a little bit more about MS pain, and she gives us her tips on how to manage it. Dr. Megan Weigel is a nurse practitioner specializing in MS care in Jacksonville Beach, Florida. She has been an MS certified nurse since 2005 and a nurse practitioner for 17 years. She earned her doctorate of nursing practice from the University of Florida, and her practice has a particular emphasis on wellness. In 2015, she was recognized as one of North Florida's top 100 nurses. She will be completing a fellowship in integrative medicine over at the University of Arizona in the fall of this year. As of this week, she is the past president of the International Organization of MS Nurses and serves on the editorial board of the International Journal of MS Care and enjoyed years of service on the Healthcare Advisory Committee for her local National MS Society chapter. She is the co-founder of OMS Yoga, a nonprofit organization that brings free yoga classes to people living with MS along the East Coast. She especially enjoys educating people living with MS and her peers about the importance of wellness as an integral piece of MS treatment. So first, we'll begin by playing a 10-minute interview with Dr. Megan. And once the video has finished, Dr. Megan will be available with us for a live 15-minute Q&A. We just ask for you to please keep your questions on topic and complete the quick survey that's going to pop up at the end of the webinar. Unfortunately, those of you who are connecting with us tonight by phone and don't have computer access, please know that you're going to hear about 8 to 10 minutes of silence while the video plays. After the video is done playing, you'll be able to hear us again during the live Q&A with Dr. Megan. Okay, let's begin.
Welcome to MS Neuro TV, presented by MS Views and News. MS Neuro TV is a comprehensive educational program bringing together MS professionals from across the United States covering the topics that you want to learn more about. To register for MS Neuro TV webinars, visit www.msviewsandnews.org. Thank you. We hope you enjoy the program.
Megan, good afternoon. How are you today?
I'm great, Stu. How are you?
Great. So today's webinar, we'd like to speak about pain management in multiple sclerosis. Can you please discuss the various types of pain commonly seen as associated with multiple sclerosis, including those, those sharp striking pains that come and go suddenly, and those, they phantomly disappear in seconds?
Just those?
just those for the moment.
No, so there about 80% of people living with MS have some sort of pain at some time. And there are two types of MS pain. There's acute pain, which is, happens out of the blue and is short-lived. And then there's chronic pain, which people live with every day. Examples of acute pain are things like pain with eye movement when you have optic neuritis. Also a Lermite sign, which happens briefly. That's when you tip your chin down to your chest and you get that electrical shock down your spine. And then also a paroxysmal spasm. So when people have these really painful drawing up spasticity problems, usually in the arm, sometimes in the leg. And then chronic pain can be from a variety of things. So chronic pain can be neuropathic, like that burning, tingling, cold sensation that someone has every day in their hands or feet. It can be musculoskeletal, which, tight neck and shoulders, or, some lower back pain. And it can also be spasticity, can be another form of chronic pain. Sometimes pain, when you have MS, it has nothing to do with MS, right? Because people fall and they hurt their knees or they have degenerative arthritis. And so we need to consider that as well.
Right. And what about, how does pain affect those with multiple sclerosis as they age?
That's a really good question, because as we age in general, our joints become a little less fluid and less lubricated, and most people will develop a little bit of degenerative arthritis somewhere. As we age in general, we might develop a little bit of instability with our walking. And then in people living with MS, if you have issues with sensation or with movement or with balance, those things are going to be more obvious to you. So pain might, or degenerative arthritis might show up a little bit more in a person living with MS, particularly someone with gait changes. So what I see is oftentimes knee arthritis can show up a little bit more quickly than you would expect in a person who's not living with a neurologic disease. Also lower back pain, because maybe people are leaning forward or have a little bit of scoliosis that is more obvious because of weak muscles and weak core strength.
Great, thank you for that. What can you tell us about optic pain, where people feel that match-like effect that goes into the eyeball, or just in general where they get maybe just the fluttering of the eye, but aren't they all considered, some kind of optic pain?
Yeah, so optic pain from optic neuritis is usually acute, which means when you have an active inflammation in the optic nerve from a lesion, an active lesion in the optic nerve, you're going to have pain when you move your eye, and that gets better with treatment for the optic neuritis, like steroid treatment, for example. However, some people have a chronic kind of dull, aching pain behind an eye that had optic neuritis. And if that changes suddenly, like if it becomes more severe, then it's definitely time to check in with your neurologist, because you could have optic neuritis again in that eye. But for people who just have that chronic dull ache in their eye, there are medications that can be helpful for, I would consider that a neuropathic pain. And we usually use things like seizure medicines and antidepressants that affect the same chemicals in pain that are involved with depression and seizures. That's why they work.
Great. So I was going to speak to you next about the medications that are available, both mainstream and those considered alternative or complementary, that are used to commonly used to manage pain. Can you tell us anything about that, or other modalities that might be used for this?
Yeah, absolutely. So in neuropathic pain, we tend to use, like I mentioned, antidepressant medications, specifically tricyclics like amitriptyline or nortriptyline, and SNRIs, which are selective neuroepinephrine receptor inhibitors like duloxetine. And we use those because they affect norepinephrine, and norepinephrine in the spinal cord is what's really involved in the pain response. We also use seizure medications, and we use seizure medications because sodium and calcium channels, which are affected in epilepsy, also modulate the pain response. So when we offer these medications to people for pain, sometimes they say, oh, wait, I'm not depressed. Am I going to have seizures now? And that's not what we're doing. We're using the mechanism of the medication to treat the pain. And they're very effective for neuropathic pain. For spasticity, we use muscle relaxers. For musculoskeletal pain, the short-term use of anti-inflammatory medications can be helpful. For neurologic pain in general, opiates tend not to be helpful. And that's actually a good thing, especially in today's climate with what we're dealing with the opiate crisis in our country. And I'm glad you asked about other methodologies, because there are a lot of other alternative things that can be helpful for pain. One of the best ones is meditation. Meditation, biofeedback, and learning self-hypnosis from a trained professional can be extremely helpful for pain, as can listening to guided imagery. So some people say, well, I can't meditate, I can't turn my mind off, I don't know what to do, there's always something going through my head. And I tend to refer them to guided imagery. And guided imagery, basically, you are listening to a lovely voice for about 10 to 20 minutes, sometimes longer, talk to you about your journey with what's going on with you right now, and it's okay if you fall asleep. It still works. Actually, the research shows that it's still effective. There's a lot of great guided imagery available for free on the internet. Actually, Kaiser Permanente offers podcasts. If you just Google Kaiser Permanente podcasts, first thing that comes up.
Perfect. What about yoga?
So yoga can be helpful for managing pain that is musculoskeletal and spastic in nature. So most of us sit around with really poor posture. If I didn't have this nice chair behind me and I were getting tired and we were talking for 2 hours, you might find me slumping forward like this. So yoga can be helpful for opening up the muscles of the chest wall and for helping with neck pain and also with spasticity in the lower extremities. You just want to be sure that you're working with a yoga instructor who's trained in adaptive needs, because we want to keep you safe, basically, when you're doing yoga. And we don't want to hurt more, right? So people with knee pain might need to be propped up to avoid further injury to the knee and such.
Perfect, thank you. And another thing that we wanted to ask you about is, what do you believe or feel about acupuncture?
So acupuncture can be helpful for pain as well. That's one of the things that it's shown to be helpful for. Again, seeing a certified acupuncture physician is important, and certification varies from state to state. The way that acupuncturists look at pain might be a little bit different than a person might think. So, for example, if I went into the acupuncturist with back pain, acute back pain, she might not put needles anywhere near my back. And I might say, well, my pain's in my back. What are you doing? And the acupuncturist will say, well, you actually have liver stagnation, or your kidneys are congested. And again, that has nothing to do with organs the way we think of them. But what that person is trying to do is help us work through the problem that actually got us to the acute back pain or to the chronic migraine or something like that. So I do recommend that people seek acupuncture. It can't hurt you, to be honest. So
awesome.
Yeah.
Thank you for speaking with us.
You're welcome.
Terrific. Hi, everyone. This is Jennifer. Good evening. That was great. I just want to say thank you to Stuart and to Dr. Megan for that wonderful interview. It's really informative and valuable information. I'm super impressed. We have a tremendous amount of people logged in tonight and engaged for this important topic. I think MS and pain can often be something not discussed or something that people will just live with. So I'm glad that we're all here tonight having this conversation. So we're going to start now our question and answer portion. Hopefully all of you can see on the top right-hand side of your screen, there should be a box where you can type your answers in. type in your questions. Your questions are going to be anonymous, so only I'll be able to see them, and I can relay them directly to Megan as they come in, and I will read them out as in the order that they are received. And I'll try to get to as many questions tonight as possible. We do ask that you try to keep them on topic to MS and pain management. So you can get all of your questions answered. And hopefully, as you ask your questions, just know that you all are also can be helping someone else who has something similar or can relate. So it's bigger than just a question for between you and Dr. Megan. It can be helping so many more on the line tonight. So I do see your questions coming in. That's great. Thank you. And I'd like to turn it over to Dr. Megan Weigel. Welcome, Megan.
Hi, Jennifer. Thanks so much.
Thank you. Thank you for being here with us tonight. So I'm going to start with our first question. I have here, can a person's pain change during a relapse or from heat?
Oh, yeah, I think that's a great question. So certainly a person's pain can change during a relapse, particularly if there's new pain involved. So, for example, pain from optic neuritis or pain from a Lermite sign, which is like a shocky sensation down your spine when you tip your chin to your chest. If your overall pain level that you're used to having gets worse during a relapse, I think that's probably just related to the stress on your body. So I think, yes, that it is possible for your general chronic pain level to increase during a relapse. And also fatigue or heat can affect people in different ways. And if your pain is neuropathic, which is that burning, pins and needles, tingling type pain, which is directly related to MS, if your pain is directly related to MS, then heat can make your MS symptoms worse. So in that case, it would worsen your pain.
Okay, great. Thank you. And our next question kind of can relate to that. Can my mood, depression, or anxiety have impact on my pain levels?
Oh, that's a great question, and I think will probably help a lot of people because the answer is a resounding loud yes. There is a significant relationship between depression and anxiety and pain, and sometimes pain can be a manifestation of depression and anxiety if a cause cannot be found. So the same chemicals, I don't know how many of you paid that much detailed attention, but we often use antidepressants to treat pain because their chemistry is the same. So the same chemistry that affects how we treat depression is also involved in transmitting pain signals in your brain and spinal cord. So many people notice that when their mood is a bit down or a bit off, their pain levels are worse.
Okay.
And just to speak to that a little bit, forms of cognitive behavioral therapy, which is a type of counseling, and biofeedback, which is another type of mind-body therapy that's effective for depression and anxiety, are also very effective for pain.
Okay, great. Thank you. That's very helpful. So this can also lead into our next question, which is how can I or my doctor tell if my pain is caused by my MS or from another condition?
Well, that might be a little bit, probably a long-winded answer. So it very much depends on where your pain is, the type of pain that is happening. For example, how you describe your pain. I'll start with there are different types of pain in MS, and the first type of pain is primary pain, which means it comes directly from an MS lesion, and that would be pain from optic neuritis or pain from a Lermite sign or burning type pain in the hands or the feet. So that's primary pain. The second type of pain is secondary pain, And that would be pain that comes from a change related to MS. So that would be, for example, knee pain or back pain that you have because your muscles are weak or your walking is different or your core is weak. So in general, neuropathic pain is described as burning, tingling, cold, pins and needles, and other types of pain are described more as dull, aching type pain. Another type of primary MS pain would be spasticity, which sometimes people describe as heaviness or tightness around a limb or around your chest with that MS hug. So I think you can work through what's causing the pain with a good description of where the pain is and what it feels like.
Okay, great. So being prepared with your description and really taking note of where
exactly
it is and how you're experiencing
exactly
before you go in.
And what helps it and what makes it worse. Mm-hmm. So, dull, aching pain from, say, a knee that hurts or a lower back that hurts might be relieved by over-the-counter remedies, whereas nerve pain probably wouldn't be.
Okay, great. So in talking about pain, I foresaw that this was going to be a hot question, and we're getting a lot of questions on CBD oil and pain management. Is there evidence for the benefit of CBD oil in the management of pain in MS? And I'll combine it with another question. Is there any research that has been done for the use of THC in MS patients?
Yeah, so I'm going to speak specifically first to medical marijuana. So this is medicinal grade marijuana, not CBD oil that you can buy at the health food store. This is oral cannabinoid extract or THC that is ingested or smoked or vaped. So the current evidence tells us that oral cannabinoid extracts can be helpful for the short-term relief of neuropathic pain, spasticity, and neurogenic bladder in MS. Mm-hmm. And that's the oral cannabinoid extract. There has been no research that tells us that smoking CBD or THC helps with any symptom related to MS. And we also, in general, wouldn't recommend smoking anything anyway because we don't know about the effects of marijuana on the pulmonary system. So that's what the current evidence tells us. And I cannot speak, too globally because I'm only really well versed in our current legal climate in Florida, and we just had medical marijuana approved this year. However, it's still there's still some issues with it legally, from what I understand. So with federal regulation versus state-to-state regulation. So I don't want to make recommendations to anyone based on that, but that's what the evidence tells us. There's a very good resource for this. It's available online. If you go to www.aan.com, this is the American Academy of Neurology website. And if you click on the publications and then guidelines, there's a guideline specific to the use of medical marijuana in neurological conditions. And there's a piece, you can have access to the documents that your healthcare providers read. There's also a summary for patients. As far as CBD oil goes for pain, I unfortunately am not very well versed in the literature. But what I hear is that colleagues tell me that people use CBD oil, they apply it topically, they use patches for pain. Some people take drops for anxiety, like under the tongue. And this is the type of preparation that one would buy at a health food store. It would not be medical grade. And the concern here is that there is no regulation, much like with supplements. There's no one regulating whether or not these substances or these products are safe and whether they're the same from bottle to bottle. So you have to be concerned about contaminants,
Right.
And whether or not you're even getting what you're getting or what you think you're getting. The other thing that I would add about marijuana in general is that we also have 2 studies that tell us that people who use marijuana for medicinal purposes who have MS have cognitive impairment. So you have to consider that in the big mess of soup when you're considering using medical marijuana. I think that people sometimes get a little, I don't know if careless is the right word, but they think, oh, it's not a medicine, I can just take it. And it actually is. It's a medicine. It has significant active pharmacokinetic compounds, and it's a psychoactive substance. So it can have interactions with your other medications, and it can cause significant side effects. So you really do need to discuss it with your healthcare provider before you try it, either recreationally or see a medical marijuana provider to consider using it for MS pain.
Okay, great. Thank you. That's great information. And if anybody needs me to send them the AAN new guidelines and guideline for medical marijuana, they can email me.
Can they see, Jen, what I type in if I type a message?
I don't think so.
Okay.
I don't think we have that set up that way. You want to try and see if we could see it?
Yeah, I'll try it. I'll look for it as we're talking, and I'll type it into that type message here.
Okay, great. And if not, I can send it out. We have a follow-up email, and I put that resource in there. And I guess the next question people are asking is where can I, or how can I find out about MS yoga classes and where they are held around the country?
So there are a couple of nonprofits around the country that teach yoga to people living with MS. So one is the one that I co-founded, and that is OMS Yoga, and our website is omsyoga.org. The other is in Detroit, Michigan, and their website is Yoga Moves, MOVES, MS, so yogamovesms.org. And they actually have a book for sale as well as videos that complement the book that you can do from home. So that's really awesome. And other than that, I would contact your local chapter of the National MS Society because, for example, we're trying to expand to South Florida, and I just spoke to a woman who teaches a yoga class for plantation, and she's been doing it for 5 years, and I had no idea who she was. And I've heard of other hospital systems and big MS centers that are doing yoga classes in their MS centers, and the local chapters of the National MS Society are usually the ones that know about those programs going on.
Okay, great. And I'll send out those resources as well in a follow-up email. So thank you for that. And Megan, we could talk about South Florida resources also for yoga. Okay, so someone is asking also, can pins, needles, and electric shock pain and crawling pain be in the legs in MS? Is that something that's found in MS in the legs?
Oh, absolutely.
Yeah.
Absolutely.
Okay. And I have a question from someone who wrote me earlier. They wanted to know if you often see spasms that occur during certain times of day or night or certain times of the year, like as if they're cyclical. Is that a common thing that occurs, or is that just unique to her?
I think that it's probably common but unique to each individual. So, for example, you may feel that your worst time of day is in the morning,
Right.
and your spasms are worse then, whereas someone else may feel that their worst time of day is at night, or after exposure to heat or something like that.
Okay.
So I do think that in general, an individual person will notice a pattern to most of their symptoms, not just spasticity.
Yeah. Yeah. And especially if you're very in tune to it. So we have a lot of questions. We're going to go a little bit over time because I do want to get to everyone's.
Sure.
Somebody's asking if you recommend taking a cocktail of different anticonvulsants, I guess, in if that's a common treatment, I guess combining anticonvulsants, is that something that's recommended, or?
I think that's very much an individual case and would depend on the other types of medications that you've tried for pain, what other medications you take, how severe your pain is, what your response is to the medications you're taking, how many different painful conditions you're trying to treat. But sometimes there is a mix of different types of anticonvulsants used.
Okay. Okay, great. Thank you. And I have a question from someone who is asking, besides taking opiates, I am wheelchair bound. What are different options? And I know you touched on that in your interview with Stuart. So options besides taking opiates would be a lot of different classes of medications. Additionally, depending on the type of pain, you might consider massage therapy, physical therapy to help with movement, acupuncture. Recent research shows that meditation and mindfulness help with pain. Breathing can help with pain. Guided imagery can help with pain. I mentioned a resource through Kaiser Permanente. They have free guided imagery podcasts that you can Google online. And I'm just sending you a bunch of notes, Jennifer, under the organizers. Thank you.
Message board here.
Yes, I'm going to share that with everyone afterwards. Great. Thank you, Megan. I guess we'll move into our final question for tonight is what type of exercises are done to help with pain, and how do I get started while I'm already in pain?
Well, the honest to God answer is you just have to get started. The type of exercises that would be recommended would be very specific to your pain, and I wouldn't recommend starting any exercise without being under the care of a healthcare provider. So my first step for, that I would advise would be to see your MS provider and ask for a physical therapy evaluation. And then you can start working with a physical therapist to learn exercises that are appropriate for you, that won't worsen your pain and certainly won't cause any other problems.
Excellent. Well, thank you. Thank you very much for sharing all of this awesome information with us and for being on with us tonight. This is very important, and we've had a lot of people here engaged to speak with you. So thank you for being with us here tonight.
Yeah, thanks for all the participation. I hope it was helpful.
Yes, absolutely. We're just going to wrap it up. I'm going to pass it over to Anna Christina, who will give all of us some final information and some thoughts. And we will be following up with everyone afterwards with an email with all of the resources that Dr. Megan was able to provide to us. And thank you again, Dr. Weigel.
Oh, you're so welcome. Have a good night, everyone.
Thank you.
Great. Thank you, Jennifer. And thanks a lot, Dr. Weigel, for giving us so many resources and answering all these great questions. I really feel that a lot of the people in this community will really benefit from all of it. And we'd also like to thank everyone here who's joined us today for this month's episode of MS Neuro TV. We really appreciate it if you could please complete the brief survey that's going to pop up at the end of the webinar. Your feedback is extremely important so that we can continue to customize our events around our viewers. As Jennifer mentioned, we will be sending out to you the resources that Dr. Weigel provided for everybody tonight. You will be receiving that through email. And just keep in mind for next month, our next webinar will be on Tuesday, July 10th at 10:00 p.m. Eastern Daylight Time. And we're going to be welcoming back MS neurologist Dr. Aaron Boster, and he's going to be giving us an overview on infusion MS therapy options, what's new in the world of infusion MS therapies, and he's also going to be discussing about their efficacy and safety. So if you're watching today's webinar live, then congratulations, because you are already registered for the entire series for the rest of the year. If you are not registered for the series yet, you can find the registration link on our website, Facebook page, or in this video's YouTube description. This video will soon be uploaded on our MS Views and News YouTube Learning channel, so please don't forget to subscribe to our channel to stay updated with everything that's new. You can also follow us through Facebook, Instagram, and Twitter. And for more information on all of our events, including our live events, and to know about what's going on and what's new in the world of multiple sclerosis, please visit our website at www.msvn.org. And last but not least, we'd also like to say thank you to Sanofi-Genzyme, Biogen, and Celgene for making this program possible and for continuing to support our multiple sclerosis community. And again, thank you everyone who has joined us here today, and we'll see you all again next month.